Health inequities affect communities, affect our patients, affect our children. Disparity has created these inequities that lead to outcomes that disproportionately affect those we serve. We have the programs, we have the research, the investigation to be able to improve the health of our community, of our children, to be sure that those that surround Columbia and those that surround us globally have the very best possible outcomes.
As pediatricians, it's very important to address health disparities to ensure that every single child, regardless of their race, ethnicity, their place where they were born, their socioeconomic status, has the chance to achieve their maximal potential. And we are uniquely positioned here at Columbia University because we have a wealth of knowledge and resources and longstanding partnerships in the community.
There are a number of things that Columbia is doing to help address this issue, particularly within our Department of Pediatrics. And as a result, I have been partnering with an organization called Futures Ignite, which advocates for environmental justice, particularly here in the Washington Heights community. We've embarked on a study to help the students in this neighborhood think about how to measure air quality in their community and really advocate to improve air quality in their neighborhoods. So this summer we're launching a project where we're going to have the students wear a monitor like this that measures in real time air pollution concentrations, and then they'll be able to take those data back to city officials to really advocate to improve the neighborhood around their school.
The Next Gen Chefs program is food as medicine program that's trying to get the kids to become connoisseurs, become chefs, to think about what they're putting into their body. We're teaching kids to make simple recipes that are delicious and healthy for them, with the goal to decrease long-term complications. But most importantly, they're really enjoying participating in the kitchen, and some of them now are cooking with their parents.
Ever since I started working with Dr. Vargas, things have been getting better for me. I started seeing food as it's not a bad thing, it's more like more proportion eating and more like watching what I eat instead of eating a lot. Now I can eat a certain way, and it helped me more now as I gotten older.
In this program, I'm learning about my diabetes and how to maintain my portions and how to take care of myself.
She can learn more about her options for her diabetes, so she's not alone too, because it's another kids. She's learning a lot.
Our Food Farmacia program that started as a mobile food pantry developed during the pandemic to a delivery model. We partner with New York Presbyterian's program CHALK, Choosing Healthy and Active Lifestyles for Kids. What we're trying to demonstrate is a population-based approach. We're giving food and healthy produce at low cost to women who are pregnant or children in their first 3 years of life. Can lead to a lifelong of health trajectory for that child and for that family.
Young men don't typically engage with our healthcare system outside of the emergency department. At the Young Men's Clinic, we are trying to resolve that issue in several ways. One, by engaging the young men in our community, but also teaching others across the nation about how to engage young men into care.
Met Dr. Bell at the age of 14. Before the Young Men's Clinic, there wasn't really a space where you could go to actually speak with people or professionals about, mental health or your physical health. So having that access, kind of that safe haven in the community was just something amazing. It was great.
Columbia Children's Health is intensely committed to diversity, equity, inclusion, and justice. We have created many programs and initiatives which represent the ongoing work of our faculty, of our teams, to serve, reflect, and advance our community and academic mission and care mission.
We are in New York City, and so many different types of people come through our doors every day that we engage all of those people in research. And it's going to inform or help us understand how to treat not only the patients that are within our hospital or within our immediate neighborhood, but people around the world are actually learning from the science that we are doing here.
Columbia is a leader in adolescent and young adult male health. We established this program in the 90s, and it has grown and has been incredibly successful. We hope to be an example for all institutions across the country.
So many of the programs that advance health equity, that investigate and learn how to mitigate disparity, would not exist were it not for philanthropy and the generosity of our Columbia Children's Health community. Addressing healthcare disparities in our community will demonstrate how to address healthcare disparities everywhere. Columbia and Columbia Children's Health are leading the way.